This is Duncan Turner from the Vagina Doctor podcast. Welcome to the Consult With Me segment where we take a deeper look into our most frequently asked questions. But what do I know? I'm just a vagina doctor.
A lot of times people call and they have really bad perimenopause.
Yes.
And they're on the birth control pill and they're not ready to go on to hormone replacement therapy. I mean, they're in that in-between
that
place.
difficult time of it in between because it's harder to treat those patients.
Right. So I just want to know, like, how long you let people go in that in-between before they transition.
Well, I don't think that the birth control pill is the answer for those patients. They're often put on that by their primary care physicians.
Yeah.
But they're older patients. They're usually 45 or older.
Yes. And
there's a significant risk with birth control pills to a patient of that age. So if they are symptomatic from the perimenopausal time, which most of their symptoms or a lot of their symptoms are because of irregular bleeding, then that's why they're being put on the birth control pill. But it's not the best thing to do because of the dangers. There's an increased risk of blood clots with patients on birth control pills. So I would usually recommend just using low doses of hormone replacement therapy at that time. And
like
sometimes just estrogen.
Dose?
Yeah, a static dose can be used the same to resolve the symptoms. And we just watch those patients carefully. But that is the difficult time for patients because they're very symptomatic. It's easy before they go into menopause to treat irregular bleeding. And it's easy to treat menopausal symptoms after menopause. But that period of time, which can be as much as 10 years of the transition from 45 to 55, can be miserable for people. And so I would choose to use a bioidentical hormone in those circumstances, whether it's progesterone or estrogen or both, than use a birth control pill. The only purpose of using the birth control pill is for those patients who have no other form of birth control and they're still at risk for getting pregnant.
Oh, yeah. Okay.
In which case, if bleeding is the issue, hormone-based IUD is a good idea.
Okay.
A Mirena or something like that.
Okay, great. Thanks for listening. And if you have more questions, please let us know either by email or DM us on the Vagina Doctor podcast.
See you in the next episode. The Vagina Doctor podcast. It all starts here.